I'm here representing the Indigenous voice in the Leadership Forum. We are here to sound a clarion call about the disproportionate impact both tuberculosis and HIV are having on Indigenous peoples globally. Together, we must all resolve to have a stronger response to this pandemic. There are more than 370 million Indigenous peoples in 70 countries around the world who are among the poorest and most marginalized communities. In these communities where data is available, the burden of TB is 20 to 30 times greater than those in the general population. Rates of HIV infection are 10 times higher than in non-Indigenous populations. We, the Indigenous voice, call upon the United Nations and its member states, UN intergovernmental and non-governmental organizations, the corporate sector, donors, and civil society to, one, urgently recognize and address the unique needs of the global Indigenous peoples in order to effectively combat HIV and tuberculosis in our communities. Two, support the development and implementation of a global Indigenous Stop TB initiative and to develop targets and assure they are met. Three, provide political support for the initiative. Four, facilitate links among global Indigenous communities and with the global leadership who are involved in the global HIV-TB response. And five, demand resource mobilization, data and surveillance development, and access to tuberculosis and HIV services through all sectors in order to strengthen control programs in a meaningful collaboration with Indigenous communities. The Assembly of First Nations is committed to continue to expand the Global Indigenous Stop TB initiative and intends to further engage and report its progress at the Stop TB Partnership Forum to be held in March 2008 in Brazil.
But let me just summarize what I think the call for action, again, even if I repeat myself. Tuberculosis undermines investments in life-saving drug treatment for people living with HIV. We can and must enable universal access to the HIV-TB interventions we have today. New tools are needed. We must have more research. Fourth, partnership at community levels, at every level of society is absolutely key. If there is to be real progress on HIV-TB, it will only be through strategic and coordinated collaboration across communities all over the world. Coordination is absolutely essential. We need the civil society to be coordinated with the state. We need the state to be coordinated with civil society. We need budgets at the state level dealing with the health problems. There is no possibility whatsoever to think that the Global Fund will attend to the three pandemics if there is not any penny corresponding at the national level for public health and of course for the pandemics, as we said here before. This is an unending process. The problem with unending processes is that first we have to have results, and there are good lessons, good results from where we can extract very good efforts that have been taking place, but at the same time we go forward with the experience, with science, with lessons learned, with accountability, and of course the dynamics that everyone has to have when confronted with this dramatic civilization pattern. How can we go everywhere every day without thinking that there are millions dying of these illnesses while life is going on? And I think this is a pattern dealing with our civilization. I don't think this is really bearable if we think 2 minutes about it. Perhaps we forget it many times, but those who are on the ground, who are touched by these pandemics, and we see the orphans. I'm not a demagogue. I don't have any more campaigns, electoral campaigns to fight. It's finished ages ago. But what I say is that we need this extra movement coming from everywhere, that we do have a perception of what is necessary to be done, and this I think is the way in which I would finish, by thanking you all from the highest levels of the international organizations to the rank and file at the local level, which takes this flag forward. And I think we need all your involvement for the next months, years, and perhaps decades. Thank you very much.